what do you think of the newly proposed health care reform bill?
Well, thank you for letting me share my thoughts. You know, I'm Woodrow Wilcox, and I'm the Senior Medical Bill Problem Solver for Senior Care Insurance Services in Northwest Indiana. We're the largest seniors citizen-oriented insurance agency in the Midwest. We have thousands of clients, and 95% of them are senior citizens. So for 6 years, I've been helping senior citizens with their billing problems, medical bill problems, that are caused by mistakes at Medicare.
Oh, interesting.
And I've saved senior citizens over $600,000 of wrongful charges that they would have had to pay if they didn't come to us and let us help them. And we provide the service of helping straighten out medical bill problems caused by Medicare at no charge to our clients. And I only do it for our clients. So I've got all this experience, and I started writing articles about the problems with Medicare over 6 years ago. And then I've collected many of those articles at one point, one site on the internet, which is MedicareProblems.net, MedicareProblems.net. And then I started adding videos of what some of our clients have said about my work helping them. And then I started adding more videos concerning Medicare problems, medical billing problems, VA problems. So I've got a lot of experience.
The veteran problems?
Veteran problems too I help with. Now I can't always help with all of them, but we only do it for the veterans who are clients of our insurance agency. Those are the only ones we do it. I can't work for outside people. I get calls from people asking me for help. I said, I'm sorry, I'm dedicated to working on our clients' problems.
So what's the problem with the veterans?
Well, you know, the problem is that one government agency cannot bill another government agency. And for years, the VA has not been billing Medicare, which means that the annual deductibles, Medicare Part A, Medicare Part B, are getting skewed, and as a result, senior citizen veterans who use the VA, Medicare, and a Medicare supplement insurance company end up paying more than what other people pay who never served our country because of the skewing of the figures. And I'm working on that for several of our veteran clients. There are techniques that I teach them how to minimize that and so forth, because when I have to deal with Medicare, I'm dealing with one government agency. When I have to deal with Medicare and the VA, I'm dealing with two government agencies. That's like David going against two Goliaths. And it's very difficult, okay? Anyway, my opinion is that Obama and those who promote the health care reform bill are misguided. They believe that simply creating a new Medicare system to handle everybody is going to solve the problem. But I'm pointing out there are too many problems with the current Medicare system, the current VA system, and the current Medicaid system. All of these have problems. All of these are hurting people. And if we impose a new national system on everyone that is modeled after these, we'll be creating medical bill problems for everyone in the country. And so my point is, let's fix the problems with the current systems first, before we create problems for everybody else. And you can read my articles at MedicareProblems.net, MedicareProblems.net. I was just at a meeting last night and spoke to Congressman Wilcox, tried to educate him on the problem that many of his constituents are facing. Problems with VA, problems with Medicare, problems with Medicaid. These systems are not working. So believing that the federal government can create a new system modeled after these systems and solve everybody's problems is a pipe dream. It's not realistic thinking. It's not reality. And I'm trying to point out what are the realities of this. You know, Obama and his supporters are going on the false assumption that Medicare works well, that VA works well, that Medicaid works well. That's a false assumption. And whenever you base your future actions on a false assumption, you and other people around you are going to get hurt. And so I'm trying to avoid a lot of hurt for a lot of people by saying, look out, there are problems with the current system, let's fix those first, and then we can move on to other things. My name is Woodrow Wilcox, and the website is MedicareProblems.net, MedicareProblems.net.
So you are not saying you're against the plan in total?
I'm against this particular plan, HR 3200, that was reported out by the Energy and Commerce Committee of the House of Representatives is a bad bill. And I even have at my website an interview of a doctor from Indianapolis who read the entire bill, wrote a multi-page letter to Senator Evan Bayh about all the problems in it, and then I posted his letter to Senator Evan Bayh without editing it, and I also interviewed him. There's 2 interviews of that doctor, and part of the problem is he doesn't like that this H.R. 3200 would allow people who are not doctors to sign death orders for senior citizens or handicapped people or people that the government doesn't want to pay any money for to keep them alive. And he also pointed out that Ezekiel Emanuel, the brother of Rahm Emanuel, White House Chief of Staff, would be one of the people helping to write the regulations under this H.R. 3200, and that there are published reports both in American newspapers and European publications pointing out that Ezekiel Emanuel, who would help write the regulations for this bill, is very much in favor of euthanasia and very much in favor of cutting off health care from young people and old people that he deems are not really worthy of medical treatment.
Okay, well, thank you very much, Woody.
And again, thank you for letting me talk, and the website is MedicareProblems.net, MedicareProblems.net. Thank you.
Thank you.